Well, I actually think that you should start talking about sexuality very young, and those conversations are often led by questions that the child may have. As the child ages, and those questions need to become more, developmentally appropriate in dealing with the issues related to perhaps pubertal changes and development of healthy relationships. Along the way, also talking about what's important to families in terms of family values, because I think that's also really important, especially when we start talking about unintended consequences of sex, namely teen pregnancy. From a very young child, in terms of talking about, body parts is really important. But then as you get older and people are starting to develop, intimate relationships, it becomes more and more important to talk about things to make sure that, youth are getting the correct information and not learning it on the streets or from peers, and perhaps getting less accurate information. And there are tons of resources that parents can go to, from their physicians to different places online, like the Alabama Campaign to Prevent Teen Pregnancy, in terms of getting the conversation started. So again, I think the best way to prevent teen pregnancy is to keep an open dialogue. And again, some of the things related to preventing teen pregnancy aren't even talking about sex. It's talking about things like, this is what I expect for you in terms of your education. This is what I expect for you in terms of, where you're supposed to be, who you're supposed to be with. And then engaging more in, very specific conversations about sexuality, contraception and things like that. We are here to help you if you have questions about, as a teen, about sexuality, as a parent, if you have questions about talking with your child about sexuality, if your child is in need of a primary care home. We are here for patients 11 to 21. We're located at 1600 5th Avenue South, and you can find us on the Children's Hospital website.